What's up, guys? It's Dr. Brooks
And Dr. John
with Des Moines Spine and Sport and Another Movement Monday video. This week we're going to progress our abdominal series to a more dynamic movement that we institute with a lot of our patients that are experiencing low back pain.
Yeah, that's right. So we're going to actually use a glute bridge to help shore up that core and facilitate some of that glute firing activation.
Yeah, glute bridge is a great exercise because, like John said, we're activating the gluteus muscles as well as establishing that good lumbar spine neutral position.
Yeah, we want that stable lumbar spine, stable back. That way you don't get that back pain.
All right. So we're going to basically take Dr. John through that glute bridge series here, and we're kind of talk about some of the specifics of this glute bridge that makes it specific to someone that's experiencing low back pain. So we've talked a lot about maintaining that good lumbar spine position and having lumbar spine stability. So what I would cue Dr. John to do first is basically to press the small of his back into the table using basically a posterior pelvic tilt activated with his abdomen. And what I'd stress with him is to make sure that he maintains this neutral lumbar spine position as he moves and is dynamic through his hips. So I'm going to bring his hand back down here. The other thing that we're going to do is we're going to talk about basically John's heel position with regards to where he's starting at and then maintaining basically his heel position throughout. So what I'm actually going to have John do is basically bring his heels in a little bit towards his glutes, towards his butt. Usually what I'll have a person do is reach towards their heels. If you're hitting your heels, you're at roughly the right place. John's got a little bit of space here yet, but that's actually all right for him. So what I'm going to have him do is basically drive through the heels to bridge his hips up to a neutral position. Once again, we really want to focus on that neutral lumbar spine position. What John wants to avoid is at his finish position, making sure that he's not hyperextending and losing that neutral lumbar spine position. Going back on down. So typically this is an exercise where we're doing to, once again, reestablish that good position and kind of retrain the brain on how to move, specifically how to hinge at the hips. So we recommend basically big sets of this, sets of roughly 30 repetitions. So glute bridge, active dynamic abdominal mobilizations, great place to start for low back pain.